Welcome everyone to another wonderful episode here, Jaws Podiatry. A very unfortunate, interesting case. This is a young patient who a couple of days ago was using the motorized scooter, and unfortunately the scooter you fell.
Yes.
And the scooter fell on top of her. In the interim of the injury, there was obviously road rash, aka burn. She has multiple fractures confirmed pursuant to MRI and as well as X-rays. That's not really our concern. Our concern is this, right? The initial visit, my main concern was something that we call a compartment syndrome. The patient did not display any type of symptoms that would suggest that. Burns are very difficult to treat. Bacteria love burns. Doesn't matter if it's a road burn or simply a burn from fire, right? Like a burn from an oven, from a toaster oven, doesn't really matter. So the patient is actually leaving to Russia. The most important thing here is prevent infection, right? Infection is my main concern. So what I've recommended in order to maximize improvement, minimize any long-term potential complications, is to implement some platelet-rich plasma, the infiltration. We've used it a lot in local wound care. Certain defects, but I think that it's appropriate in this setting to inject quite a bit of PRP around the periphery and into the area to deliver growth factors and other important cells that will aid in the healing of this injury. Okay, so without further ado, let's proceed. Okay. Patient, you may feel a little bit of discomfort, okay? I always tell patients that there's definitely an element of volume expansion, but we will be, even though everything is numb, we have already numbed the area. So we'll start here, okay? And very carefully, how you doing?
That's fine.
Good, right?
Yeah.
Okay, good. So you can see this is just, we're gonna leave all this alone, and there's a little bit of drainage there. You know, obviously our main concern, she was very, very lucky because, you know, in these injuries, we see a lot of hematomas, and we would have quickly seen that. Very, very fortunate. Again, we're just pushing everything down. There's another possibility that this may all eventually, possibly, I've seen it before, it will de-roof, that it will dry up like a big old, what we call an eschar, right? And it will dry up, shrivel, and then sometimes it will actually just fall apart. Only time will tell. She's going back to Russia, so she needs to follow up with someone in Russia that knows exactly what they're doing. It's imperative. Okay, so we'll put a little bit more here. Move a little bit this way here. Okay, and then last but not least, Patient, can you please turn your, there you go. And last but not least, we'll just come in through here, okay? And just marinate everything. And then we're all done. Okay? A little bit, yeah. A little bit of, it's okay. It'll go away in about maybe 3 minutes, okay?
Okay.
Okay. But we're done. So.
Oh, I can feel it a lot now.
Yes. But give it about 3 minutes, okay? And it will go away.
Okay.
Okay? It will. I promise. Okay? Okay. So, you know, this is a bad injury. The patient is aware. Multiple fractures. How many? About 8. Good news. No surgery. At the top of the list, my main concern is the burn, right? The injury, the road rash. Because that can easily lead to other major complications. The bones, the fractures will heal. But first is first. This. Caesar, come around and just give everyone a better visual of exactly. Okay. We continue to use regenerative medicine as an alternative. Obviously, we're going to be implementing local wound care, aggressive local wound care, but I think in respect to giving the oomph factor, this is where regen medicine comes in. As always, www.jawspodiatry.com, Instagram, Dr. Tojam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. Ladies and gentlemen, please stay safe. This is, we're going through a really tough time. Numbers are up. Use masks, very important. Have a wonderful week.